Okay. Since now we have a quorum, it's 8:38, and we'll go ahead and call the meeting to order. Present, we have Terry, Larry, and Craig. And so what we were going through were the reports, so we'll go ahead and follow the agenda real quick. We have the approval of the minutes from June 7th. Is there a motion?
I move approval of minutes.
Okay. Is there a second? Okay. So, all in favor?
Aye.
Okay. With that, we can open it up with information from vendors. We have United Healthcare and Blue Cross here if we have any questions for them, or if you have any information to share. Okay. If we have questions, we'll bring you up here in a minute, I guess. We were starting to go through the reports. We had noted the group indemnity plan. We've seen a higher average in claims for the active employees for the medical side and the prescription side for retirees. The majority of the claims for retirees are going to be on the prescription side, especially with the Medicare retirees. We had mentioned open enrollment's coming up. Online open enrollment's going to be October 15th through 31st. On-site open enrollment will be the 16th through 20th at the Civic Center. We've had the 3 requests for proposals that went out for the group indemnity administrative services plan, the prescription plan, and for the HMO Medicare Advantage plan. The committees did meet, and we are making a few changes. Within the group indemnity plan, it's still staying with Blue Cross and Blue Shield. However, they're also, with their Prime Therapeutics group, taking over the prescription. So Express Scripts will not be our pharmacy provider on the group indemnity plan. We're hoping with that change, we're going to get some better case management and coordination between the medical plan and prescriptions, and hope to be able to coordinate that better and get some cost savings that way. We're going to look to implement some step therapies and prior authorizations, but the first 90 to 120 days, we're going to go ahead and fill everything as it is and see what prescriptions we have in place and what actions need to be taken, and then take a closer look at that. United Healthcare did win or have the bid for the HMO plan, so we are still in negotiations with both Prime Therapeutics, Blue Cross for ASO, and United Healthcare for the HMO Medicare Advantage plans. We are rolling out a new Medicare Advantage plan for our retirees. It's a national PPO plan, and so previously we had an HMO plan which was titled Secure Horizons back in the day. So it had about 13 counties that were approved for service, and then only emergency services outside those 13 counties in Oklahoma. What they've brought to us is a national PPO plan, so you can see any doctor that accepts Medicare anywhere in the 50 United States and 5 territories. So that's an exciting new option for our retirees, and so we've done quite a few education meetings. We've done, I think, 11 between August and September, trying to get the information out about the changes with the prescription plans, moving from Express Scripts to Prime Therapeutics, as well as the new Medicare Advantage plan.
And those will go into effect
January 1st.
1.
Yes. And so that is the highlights of what I have about the open enrollment and plan changes. I have followed up on a new committee member, so if there is anybody who has a community member that they would like to recommend for this board, we're still in search for someone. I know Craig had mentioned some changes on the reporting, so as we start rolling out some of these new vendors, we can look at changing the reports beginning in January. So if anybody has any other requests on the reports that you want us to take a look at, let me know, or Jason or Billy in my office, and we can take a look at those as well. And then the only other item I had was for topics for future meetings. I thought this might be a good forum to take on some of the education of our plans and try and get the word out. So I was going to try and get at least one vendor presenter at each meeting to talk about some of the tools that they have, whether it's a mobile app and how you can look for cost savings, or a benefit that a lot of people don't know that they have. the EAP plan, one thing that we have that a lot of our employees don't recognize is you get free taxi rides if you're intoxicated. You just have to call and the taxi will pick you up and some of that. And so just little tidbits here and there to try and help spread the word of some of the good benefits that we actually have here at the city. So I think the education meetings that we had for our retirees went over very well. We went out and presented information that we learned from the RFP, some as far as specifically, since we were targeting the retirees, prescriptions, and how it matters what you buy and where you buy it sometimes. So as part of Prime Therapeutics and that change, we're not going to have CVS as a pharmacy under our group indemnity plan. But we gave examples of, there was a metformin drug that was taken, and so 1,000 milligram metformin cost the plan, I think it was $2,065 a month, whereas if the same pill was taken in a 500 milligram form twice a day, it was $34. So that was a savings to the plan of over $2,000 by taking 2 pills instead of 1. And obviously, prices change throughout the year, or whatever the case is. And this was from fiscal year 16, so it's, I think, a cheaper drug now. But pay attention to the information from the pharmacy. You can look up the information and see how much, while it might be costing you a $30 copayment, how much of it's hitting the plan. After that falls into the rates the following year. Another point that we had made was, if you end up needing an MRI, instead of automatically going to the hospital, which might be where your doctor's going, you can shop around. If you go to a freestanding clinic, it might be a third of the cost. That not only saves you money, but saves the plan money, which will save premium dollars the following year. So we're just trying to get out there and get some of these messages out. People just don't realize this is an option for them to be able to ask questions and be a bit more engaged in their health care. So that's what we've really been working on for the last couple months. So with that, I'll open it up to committee members. If there are any questions or anything you want to talk about.
How's the activity on the clinic been?
We're still seeing increased participation. I think we had another 40 new patients last month, and so that's kind of been our trend, between 35 to 50 each month of new patients. So it's starting to get there, and so I know they're reviewing options for the clinic of maybe being able to offer a shared site clinic in the future, and working through some of those negotiations.
Is there a headcount number that justifies it and makes it forecasted for a
We haven't hit the number of lives or visits. Once it averages, I think it was 2.66 visits an hour, it justifies an additional doctor or doctor hours. So we haven't hit that number yet. But what the negotiations are looking at is we pay a flat fee for a certain number of hours and see if we can spread that among other places as well, to see if that helps increase the participation.
I was just curious, generally speaking, when you had your RFP information come back in, how many vendors actually responded to like the ASO services or to the PBM services?
Okay, the question was about the RFPs and how many responses we had. I think for the ASO we had 6, for the PBM we had 5, and for the HMO we had 4. So. Are there any other questions? Okay, it's 8:46. Oh, George.
I just want to say that Gina and her staff and the home health people came to our board meeting. It was very informative, and it was even better than the city meetings because it's personal and I could talk. I got a lot of answers, and I do appreciate the fact that you guys came down. And again, I'm going to ask this. If they don't want to change anything, they don't need to do anything.
That is correct.
Another question I want to say, I've had some calls from some of my members, and somebody's been coming out, they said, from the city, trying to, I don't know what kind of information they're trying to get, but I said, look, and he said, well, I was standing out there, this one guy the other night, he said, he was on the back of my pickup with his computer they come back, 'cause
That would not be something through the city.
they don't come out,
No.
you know, so anyway, if you hear any more of that, I don't know, but I had two people, so
What that sounds like is some of the open market.
I'm afraid
Medicare
that they
plans.
signed something somewhere and didn't realize it, and they invited somebody they invited the devil into their house.
Okay. Yeah, because,
But I do want to tell you, I did appreciate that, and my membership did too.
well, thank you.
Thank you.
But yeah, the city and the city vendors will not come out to the homes to try and gather any kind of information on stuff. So they're definitely not affiliated with us. So, any other questions? Okay. Well, it's now 8:49, so is there a movement for adjournment?